If you're over 60, you might not even realize that a simple daily habit you've been doing your whole life can suddenly alter your blood pressure and promote the formation of clots, which could cause you to have a stroke, a sudden heart attack, or silently damage your blood vessels within just a few hours. And the worst part is that it can happen without any warning, without chest pain, without clear signs, all because of small mistakes made during your daily shower. What I'm about to tell you is something hardly anyone dares to say. It's not mentioned during medical appointments, nor does it appear in health brochures. However, understanding this can make the difference between a relaxing shower and a cardiac emergency or sudden paralysis. Today I'll show you 5 shower habits you should avoid, especially if you're an older adult who already takes medication for your heart or blood pressure. Plus, you'll see how to correct them with simple, natural changes so you can keep enjoying your shower safely. Let's look at the first one: showering with very hot water. Think about that steamy shower that seems perfect for relaxing your muscles and loosening your joints after a long day. Sounds tempting, right? But that's where the problem starts. When your skin turns red under very hot water, it's because once it goes over 40 degrees, your blood vessels dilate quickly. This can cause your blood pressure to drop suddenly and your heart to work harder to keep blood flow stable throughout the rest of your body. In young people with flexible arteries and a healthy heart, this usually goes unnoticed, but after the age of 60, or in people with stiffer arteries who have already had a stroke or who take medication for the heart or blood pressure, this change can be dangerous. As I always tell my patients, an episode of low blood pressure is much more dangerous than one of high blood pressure. Why? Because a sudden drop in blood pressure can cause dizziness, stumbling, fainting, which are a very common cause of fractures and emergencies. And even worse, if your arteries are already clogged with cholesterol plaque, that drop in blood pressure can rupture one of them and form a clot that blocks the flow of blood to your heart or brain. So then, how can you protect yourself? Ideally, you should keep the water warm or moderately hot between about 36 and 38 degrees Celsius. In other words, it should feel pleasant, but it shouldn't burn your skin or leave it very red. Also, try to keep your shower short. It's better if it lasts less than 10 minutes. And pay attention, if you take medication for your heart or blood pressure, make sure to discuss this thoroughly with your doctor. And above all, don't forget to stay well hydrated throughout the day by drinking plenty of water up to 2 hours before going to bed, because dehydration can lead to sudden drops in blood pressure and make your blood thicker. Now, if you thought the problem was only with the temperature, pay attention to what can happen if you shower at the wrong time. Habit number 2, showering right after eating or taking your medication. This is a common scene. You finish lunch or dinner, take your pills for blood pressure or your heart, and go straight to the shower to relax. It seems harmless, but for a circulatory system that is no longer so stable, this can be a very serious mistake. After a meal, your body sends more blood to the digestive system to process the food. This is normal, but it temporarily leaves less blood for the brain and the heart. In general, this doesn't cause any harm, but if at that moment you take a shower with very hot water, the blood vessels in your skin also dilate to dissipate the heat, which demands even more blood. The result is that your blood pressure drops too much, leaving the brain and heart with less blood flow, causing dizziness, falls, and even increasing the risk of clot formation if your arteries are already hardened or have cholesterol plaques. And pay attention, because the risk increases if you already take medication for blood pressure, diuretics, strong heart medications, or strong painkillers, because these drugs already alter your blood pressure and can cause instability in blood flow. The good news is that the solution is very simple. Wait at least an hour after eating or taking your medication before showering with hot water. Give your body time to redistribute blood and stabilize your blood pressure. Also, keep your shower short and warm. But if you still tend to feel dizzy or weak while showering, seek medical attention. You might need a heart checkup or to investigate whether your arteries are already significantly blocked. Now, if you think the danger ends with the timing or temperature of your shower, get ready, because the next mistake happens in almost every bathroom and can seriously affect your breathing and circulation without you even noticing. Habit number 3, long showers in closed, steam-filled bathrooms. Many people like to turn the bathroom into a kind of sauna. Closed door, hot water, and an environment full of steam. It may feel like a luxury, but when your heart and arteries are no longer as strong, that trapped heat, the humid zone, can become a real challenge for your body. Look, in a closed and humid space, your body's internal temperature starts to rise. To cool you down, your heart beats faster and pushes more blood toward your skin. That extra demand, combined with the effect of some medications for blood pressure or the heart, can cause the circulatory system to suddenly become exhausted and blood pressure to drop. At the same time, the heat and humidity make your body lose fluids without you even noticing. That silent sweat can dehydrate you and make your blood thicker, making it harder to flow through aging arteries, especially if you haven't drunk enough water during the day. That thicker blood is more likely to form clots, especially if there are already cholesterol plaques or blocked arteries. And on top of that, overheating and being in a closed space can throw your circulation off balance, causing dizziness, falls, and dangerous fainting spells. What do I recommend? Keep the bathroom well ventilated by opening a window or using an exhaust fan, and at the same time, avoid taking very long or very hot showers. And if you notice dizziness, weakness, or blurred vision, get out immediately, ask for help, and sit down to recover while you hydrate. So far we've talked about heat and being in a closed space, but there is an opposite danger that's even more devastating, especially if your arteries and heart are no longer in the best shape. Habit number 4, hitting yourself with very cold water, especially in the morning. Cold showers have become trendy. Influencers and even doctors recommend them to activate the body. In young people with flexible arteries and a healthy heart, this is usually well tolerated, but in older adults who are more frail, when the arteries become stiffer and the heart loses its ability to respond quickly, a shock of cold water can be dangerous. And pay attention to this. Sudden contact with cold causes blood vessels to contract abruptly, which is a natural reaction of the body to conserve heat. The problem is that this sudden change can cause a spike in blood pressure within seconds. And if you already have cholesterol plaques that are prone to rupture or very hardened arteries, that sudden increase in pressure can damage their walls and promote the formation of clots. In someone with health problems like hypertension, diabetes, or high cholesterol, that clot can reach the heart or brain and trigger a sudden heart attack or stroke. Now, how can you protect yourself? If you want to use cold water to wake up or feel more active, do it gradually. That is, start with warm water and lower the temperature little by little instead of subjecting your body to a shock of ice-cold water. That way, you can benefit from the refreshing sensation without exposing your arteries to stress that could be dangerous. But if you already have heart disease, poorly controlled blood pressure, or have recently had a stroke, it's best to avoid very cold showers. Alright, we've reached the most critical part of the video. The next mistake can set the stage for your heart and brain to be at risk while you sleep. Habit 5. Showering very late, right before going to bed. For many people, a bath at the end of the day is a relaxation ritual. The house is quiet, the stress disappears, and the warm water seems perfect for a deep sleep. But as the years go by, that everyday habit can work against your heart and your brain. When you shower very late, your internal temperature rises just when your body should be cooling down to sleep. This imbalance forces your cardiovascular system to work harder. And while your body tries to regulate itself, you can lose fluids through sweat without even noticing. In more frail elderly people, especially those taking medication for the kidneys, heart, or blood pressure, this combination increases the risk of dehydration and drops in blood pressure during the night. Thicker blood and slower blood flow encourage the formation of clots in arteries that are already hardened, increasing the risk of heart attacks, arrhythmias, or strokes while you sleep when it's harder to ask for help. Now, how can I avoid this risk? If you like to shower at night, do it at least 2 hours before going to bed, ideally before 8 in the evening. This way, your body can recover its temperature and stabilize your blood pressure without needing to drink a lot of fluids so late at night. Also, keep the water warm and make sure to stay well hydrated throughout the day. And after your shower, if you feel thirsty, take small sips, avoiding large glasses so you don't wake up frequently to urinate.